stick their finger and stain the blood smear and look at it. And you can tell an awful lot about a patient when you do that. I'm Dr. Marc Kahn. I'm a professor of medicine and section chief in hematology at the Kerkorian School of Medicine. I'm also a member of UNLV Health. A hematologist is a subspecialist in internal medicine. So hematologists generally do internal medicine residencies that are about 3 years in length. In my case, I did an extra year as a chief medical residency. And then you do a fellowship in hematology medical oncology for 3 years. I consider myself more a hematologist than an oncologist, so I deal with diseases of the blood. Particularly, I have an interest in non-malignant diseases of the blood, but the specialty of hematology includes disorders such as leukemia. For the non-malignant part, we deal with problems with anemia, we deal with problems with bleeding, and problems with clotting. Those are some of the most common disorders that we see. I had an early ambition to become a physician to take advantage of my interest in science. Interestingly, when I got to college, I didn't have a lot of money, and part of my financial aid was work-study. And I worked in a medical laboratory. And the first thing I did is I was just washing glasses and dishware. And that's because I was only a freshman. But eventually I got my own project and completed it and published my first paper. And it really hooked me to an interest specifically in academic medicine. There's an old adage that's sort of cliche now, but it's the secret of patient care is caring for the patient. Again, not to be too cliche, but that's what it's all about. So at the end of the day, we need to do what's best for that patient with that problem at that particular time. The best part of my job is seeing a patient who doesn't have a clear idea of what's the matter with themselves. And for me as a subspecialist to be able to put things together to make a diagnosis. One of the things I like to do is I like to look at pictures and images. So one of the things that attracted me to hematology is you get to look at patients' blood smears. And I do that in my office. I stick their finger and stain the blood smear and look at it. And you can tell an awful lot about a patient when you do that. And I love putting that image together with the patient and the patient's symptoms and complaints.